So now we're going to go through blood flow through the heart. So blood is going to come from the superior vena cava and the inferior vena cava from the systemic circuit. So this will be oxygen poor blood. It's already circulated throughout the system. It's given dropped off oxygen to your tissues, and it's picked up the waste product CO2, and it's going to that blood is going to be pumped. Well, it's not going to pump, but it's going to flow back to your right atrium. So the right atrium is one of those receiving chambers. And on a test, often we'll say, hey, you're a little red blood cell in the right atrium. What valve are you going to flow through next? So here's a great question for you. So what valve are you going to flow through next? And of course, that will be your tricuspid valve. And maybe I'd say, like, you're in the right atrium, what chamber are you going to go into next? And of course, that would be your right ventricle. So once you're in the right ventricle and that ventricle contracts, blood is going to be pushed through that pulmonary valve, and then you are going to go into that pulmonary trunk. And the pulmonary trunk, that gives us a hint to where we're going. We need to go to the lungs because we have oxygen poor blood, and we need to drop off CO2, that waste product, and we need to pick up more oxygen. So we're going to go through the pulmonary arteries, and the pulmonary arteries are very unique because they are the only arteries in the body that actually have oxygen poor blood in them. Arteries are always pumping away from the heart. Arteries away, veins go towards the heart. So once we go through the pulmonary arteries, we're going to go through the pulmonary arterioles and the pulmonary capillaries, and then the pulmonary venules, and then we're going to come back to the heart. Because we went through those capillaries, we picked up that oxygen, we dropped off that CO2, and then we're going to come back to the heart through the pulmonary veins. And notice the pulmonary veins, we have them on both sides here. So these are pulmonary veins here, these are pulmonary veins here, and we're coming back to the heart. We're going to come back to that. Actually, that'll be your left atrium. So we picked up oxygen, so therefore these pulmonary veins are colored red because they are carrying oxygen-rich blood. The pulmonary arteries up here are carrying oxygen-poor blood, therefore they are illustrated in blue. So we come back via those pulmonary veins, and then we'll be in that left atrium. So if I'm a little red blood cell in that left atrium, what valve will I pass through next? And that would be your mitral valve or your bicuspid valve. So you can call it either one. Again, the way I remember it, in the path of blood flow, you go through the tricuspid valve first, and then you go through that bicuspid or mitral valve second, because you need to try something before you buy something. And once you go through that mitral valve, then you will be in that left ventricle. So that is the big, meaty ventricle. That is a very muscular ventricle, because we need to pump that blood to the rest of the body, to the systemic circuit. So when that left ventricle contracts, we're going to go through that aortic semilunar valve, and then we're going to be going through the aorta here. So that is blood flow through the heart. So make sure you have that down. So this will help you with some of your tracings, with your tracing, and it'll help you with you really need to know this. It's not too difficult once you break it down, and it'll help you in many classes that come.